Miss Brown, you may come in. Hi. Hey, how you doing?
Am I right?
I'm Courtney Nolden from the Sunflower County Health Department. How can I assist you today, Miss Brown?
I am a student at Mississippi Valley State University. I'm 20 years old and I am pregnant with my second child. And I'm not sure if I'm ready to have another child or have an abortion because my 1-year-old is now currently staying with my mother. She has been a big help to me and my boyfriend as well because he's not working. And I really don't think I'm ready to go through with having another child at this age. And times are kind of hard right now.
So you don't plan on getting a job so that you will be able to support the baby instead of aborting it?
As of right now, I have been applying for jobs here and there online and going to different places, restaurants, but with school, it's just that I don't have that much time to work and school.
So does your mom know about it?
Yes, I have talked to my mom, and she's against abortion. She is a Christian lady, and she thinks the best thing for me to do is have the baby, continue with my education, and she'll help me take care of the child. But I don't want to burden her by taking care of two of my child that I laid there and made. So,
Okay, that's understandable. So do you think you really want to have an abortion?
yes, I have done research, and I'm thinking this is the best thing for me right now.
Okay.
And I have a few questions that I need to ask you on what type of abortion is better, medical or surgical?
Well, women under 9 weeks pregnant may elect to have either a surgical or medical abortion. Women over 9 weeks pregnant are eligible for surgical abortions only. If you are under 9 weeks, what is better for you may differ from someone else. It is important to make this choice based on what is best for you, according to your personal needs and medical history. For now, visit our page. You could visit more. It's sites that you could visit. So if you,
Will surgical abortion hurt?
well, most women are able to get to their abortion, which lasts around 5 to 8 minutes with minimum discomfort. Some centers offer pain medication, twilight sedation, or general anesthesia to help women through surgical abortion. While surgical abortion without any pain medication can cause cramping, similar to or severe than a menstrual cycle, every effort will be made to make you as comfortable as possible.
And will the medical abortion hurt?
As with surgical abortions, everyone's experience with medical abortions will differ. Because medical abortions are completed at home, we offer patients pain medication and suggest various techniques to help make their experience as comfortable as possible. Medical abortions occur similarly to miscarriages, which can result in heavy bleeding and cramping. Most women report cramping that is similar to or more severe than their menstrual period.
And how long will the appointment last?
Whether you are a surgical or medical abortion patient, you should plan to be at a center for about 3 to 6 hours. Upon arrival, you will fill out paperwork, then review your medical history with the nurse or medical assistant. You will undergo lab work and ultrasound. You will receive a counseling session, review surgical or medical consent forms, and in some instances, receive pre or post-abortion medication. Whether you opt for the surgical or medical abortion, you'll meet with the doctor for your procedure. Medical abortion patients will take one series of pills in the office and receive additional medications to take home. Surgical abortion patients can expect the actual procedure to last about 3 to 5 minutes long, and surgical patients will be taken to the recovery from recovery rooms following their procedure for up to an hour.
How will I, how do I pay, or will my insurance cover the abortion?
Well, every insurance plan and state has different policies about abortion coverage. Lower income women may be eligible for state assistance. It is best to contact the Islamic Center nearest you with questions regarding the cost, payment policies, and financial assistance. For women paying out of pocket, cash and credit cards, they are accepted.
Are payments plans or financial assistance available?
Well, like I told you, every women with lower income may be eligible for state assistance.
And how long will I have to wait before I go back to school after having an abortion?
Well, women who have surgical abortions often return to school or work within a day or two after their abortion. But women who have medical abortions often require 2 full days off of school or work. Though we recommend taking these for the first week or so after your abortion procedure, most women feel physically capable of daily activities very soon after their abortion. Doctors' notes for missed work or school are available. And during that process, you are not to do any heavy lifting or intense physical labor or workouts.
Okay, and how soon after my abortion will I be able to have sexual intercourse or use tampons?
Because of your risk for infection increases until the cervix is fully healed, we recommend that nothing go inside the vagina for at least 2 to 3 weeks, or until your follow-up visit. This includes, but is not limited to, no sexual intercourse, no sex toys, or penetration of any kind. No tampons, use only sanitary pads or liners. We also recommend avoiding swimming, hot tubs, or bathtubs.
And can my partner, friend, mother, or anyone be with me during the abortion?
Yeah, in most cases, we only allow parents and medical staff into the operating room for safety and confidentiality reasons. However, you will have a nurse, a counselor, and a medical assistant with you during your procedure. Your loved ones will be kept informed of your progress throughout your visit, and extra care will be taken to visit with partners, family, or friends who are nervous or anxious about you.
Will I be able to have children years from now or later on?
Well, in most cases that I know of, most women aren't able to have many kids because they've been had several abortions. But it's even said that if you have one abortion, it can affect you because what affects you may not affect other women, and what affects other women may not affect you. So either way it goes, you're taking a risk of not being able to have children in the future. So are you sure this is what you want to do? Are you want to go through the procedure? Are you think you're strong enough to do it?
I think I am strong enough, and this is the decision I'm going to make. I will talk with my mom and boyfriend more about it, but at this time I know I'm not able to take care of a child in my situation right now.
Well, that's understandable. Well, you can just keep me updated. Here, I'll give you my card. I'll leave my number. Stop. Okay, well, there's some pros and cons of having an abortion. I mean, if you, for example, if you were raped or something, or something dealing with incest, then abortion would be needed, because I don't think you would want to have a baby just like that. I mean, wasn't your plan, but you could mean, I'm not gonna, in the near future, you might feel guilty about it. You might feel as though you made the wrong decision. So, I mean, I'm not gonna say it's gonna be easy dealing with it, but at the end of the day, you will have to deal with it because it was your decision. But since you say you are sure, then well, although it's in your plans to have the abortion, I hope it's not your final decision. So research a little bit more, take the information I've given you, and do a little more research to make sure that's what you really want to do.
Okay, is it okay if me and my boyfriend and mother come have a meeting with you one day that she's not working?
That'll be fine. That'll be fine to come so we could, the three of you, including me, we could have a good understanding to make sure you don't regret it. You don't regret what you've done. So yeah, I think that'll be the best thing to do.
Okay, Miss Nolden, I really enjoyed talking to you today.
Thank you for seeing me.